So you hate your nursing job and you're ready to start doing something new, preferably remote? Congratulations, you're in the right place. Welcome or welcome back. It's your girl Steph J, and over here we talk about all things beauty, lifestyle, and nursing. Today we're going to do a highly requested video where I've seen a lot of comments on people asking me how to get into utilization management, how to become a utilization management nurse, and just how to pivot into it overall. And a little bit of my story regarding how I worked as a utilization management nurse a couple years ago. So let's get into it. And I want this video to be as informative and laid back as possible. So let's start with the definition. What is utilization management? Utilization management is the process of evaluating the medical necessity, appropriateness, and efficiency of healthcare services. It ensures that the patients receive the right care at the right time while optimizing healthcare costs and resources. Essentially what that means, we want the patients to get treated, but at the most affordable way for these companies. At the end of the day, healthcare is a business. They need to get paid as registered nurses, doctors, PAs, MAs, CNAs, OTs, SLPs. Everybody needs to get paid. And the way that these big hospitals are able to keep money functioning, getting money from the insurance companies and vice versa, we need to make sure that healthcare costs are efficient and appropriate. Utilization typically includes three things. First being prior authorizations. This basically means we're taking care of treatments, medications, and procedures before they occur. So we're submitting these prior authorizations to the insurance company from the hospital to the payer to say, hey, we have this patient who has X disease or disorder and they need to get an Ocrevus infusion once every 6 to 8 weeks. Here are the clinicals. Can we get this for this patient? They're either going to say yes or no. Yes, you can get the medication at the highest level of care, which is the hospital, or hey, no, we don't need it. You don't need to get that medication. You need to try X, B, and C treatments before you even come and ask me for this Ocrevus. Or C, you can get this medication, but you can't get it at the hospital. You need to go to an outpatient infusion center, or you need to try home health therapy. So if you understand the drift, prior authorizations occur before the treatment or the service actually occurs. Number two is concurrent reviews, which basically monitors the patient while they are still admitted to the hospital. With concurrent reviews, that's the type of utilization management I was doing when I was an inpatient case manager on a medical surgical floor. Essentially, the patient has to meet criteria to even be inpatient. When I was in that role, I would use interqual in order to get the patient to meet for criteria. So if a patient had sickle cell and they got admitted to the floor, it's like, to meet criteria, I believe they would need to be on oxygen, they would need to be on a PCA maybe, and they would need to be on some kind of other pain medication just to meet. Again, don't quote me, I did this like 3 years ago. But essentially, you go through all of these check boxes in interqual. There's also a system called Milliman, but I'm more comfortable using interqual. I feel like interqual is the easiest way for reviews. And then you would look at the doctor's clinicals and see their notes. Pull out the pertinent pieces of information and try to meet criteria. Then you would submit everything electronically, the interqual and the doctor's notes, to the insurance company for review. Then the insurance company would review that information, and they would give you a span of days for how long the member is approved to stay inpatient or denied. So sometimes you would get the approval like, okay, the patient is allotted 3 to 4 extra days in the hospital. It's already approved, covered. Cool. So that goal would be get this patient discharged by that 4th day. If it's looking around day 2 or 3 that the patient is not going to get discharged, it is your job as that case manager to look at the additional clinical, to talk to your healthcare team and say, hey, if this member is going to say this, I need you to write your notes a certain way to really paint the picture to the insurance company as to why they still need to be admitted in the hospital. Just because you get approved for a hospital stay extension one time, it doesn't mean that it's gonna get extended a second time. Typically, every disorder or disease has a average amount of time where the member should be admitted, but every person is different, every disease course is different. That doesn't necessarily mean anything. So it's your job to really find the details and make it align. In this role, it depends where you do this role. You can do it in the hospital like I was, but you could also do it from home remotely. The thing is, the people that you're going to talk to are primarily your insurance company contacts or the doctor that you're working with on this case, because either their clinicals are lacking and you kind of need to tell them what to do to make sure that this stay gets approved. Yes, you're a registered nurse, but you need to partner with your doctors. A lot of these doctors, sometimes their notes just aren't the best, and when you have your clinical rounds every day, it is your job to make sure that you are assisting them to the best of your ability. They're really busy, and if you want it to get approved, it's going to save you a lot of headache on the back end. So just do what you can and help your doc out. And the third type of utilization management is called retrospective review. So this type is what occurs after the hospital stay has occurred. With retrospective reviews, you're basically assessing the efficiency and the type of care that the member received while they were admitted. With retrospective reviews, you're going to start with a medical necessity assessment, which basically entails going over clinical documentation, looking at the clinical guidelines and the provider documentation to see if the member truly needed to be inpatient for this disease, disorder, flare up, or could they have handled this thing in the outpatient status or on observation status. The main thing to focus on when it comes to retrospective reviews is to see, was the entire hospital stay justified? You're also going to look at claims and billing reviews. Was the provider over billing for certain procedures? Did they even need to get certain tests? Why didn't they start at a lower level of treatment first before escalating to another type of imaging? Are there duplicate claims for services that weren't even rendered during this hospital stay? Basically, the job is supposed to help cut down on fraud and waste and all the kind of legal stuff. It'll also go into quality and compliance checks. So basically, is the doctor treating the patient according to evidence-based practice? Are they deviating from the traditional treatment plans? Like, if I have chickenpox, why are you giving me antibiotics and a PCA? That don't make any sense. So it's your job to look for details like that don't make sense, and run your little red flag. Another aspect of retrospective reviews is appeals and denials. So if a claim is denied on their retrospective review findings, a patient or provider can appeal that decision to give the case a second look. Nurses and case managers help to gather information in order to support that appeal, in order to see if we can get this claim covered. Where can you work if you want to be a utilization management nurse? You can work for a hospital, you can work for an insurance company, you can work for managed care, or you can work for companies that have quality improvement initiative. Because if you haven't realized by now, utilization management takes a lot of data analysis. You have to review trends, you have to review notes, see what happens, and try to elicit or cause better outcomes in the current or going forward. And just to wrap up this section to make sure that we're all on the same page, prospective reviews equal pre-authorization before the service occurs. Concurrent reviews equal real-time monitoring of when the care is being provided. And lastly, retrospective reviews is for post-care evaluation, cost management, and long-term system improvements. Do you need any additional education or certifications for this role? No. You do need to be a registered nurse to be in this role. I don't know if LPNs can do this kind of work. I'm not sure. You would have to check with your state's legislature to see if that licensure is able to do utilization management, but if you want to be a utilization management nurse, typically you only need like a year of nursing experience, because they want you to be able to analyze patient data. Even though you're not having hands-on patient care, you still do need to use your nursing judgment in order to know what's appropriate, to know what's not appropriate, and to see deviations in the patient's care. And while there is a certification for case management and utilization management, you don't need it to get in a role like this one. And if you're a registered nurse that wants to transition into utilization management from the bedside, here are some of my tips. I wrote my notes down because I want to make sure that I got y'all covered. So the main thing would be just to leverage your clinical background, no matter what it is. Talk about treatment plans, talk about interpreting clinical data, talk about collaborating with your healthcare providers, because those are tools that you're basically going to have to use in your day-to-day basis as a UM nurse. So make sure that you're adjusting your resume. You also want to learn utilization management basics, Medicare, Medicaid, government, and state guidelines when it comes to coverage and reimbursement. You also want to develop your critical thinking skills and your analytical skills. These are things that the company is going to want to see. And if you want to be really fancy, talk about ICD-10 billing codes, CPT, and DRG codes. Transferable skills to add to your resume as a utilization management nurse include clinical expertise, collaboration, documentation and compliance, and cost containment. Now we're going to talk about some roles and titles that you can look into on LinkedIn, Indeed, or these company websites if you want to become a utilization review nurse. Number 1, utilization review nurse. Number 2 would be case management / utilization management. I was working in a dual role when I worked in the hospital, so I was doing case management and utilization management at the same time. It is a lot, but you know, that's how I got my foot in the door and why I'm working remote now. Number 3 is a medical review nurse, and number 4 is a clinical review nurse. Let me know down below if you think that you'd want to be a utilization management nurse, or the type of utilization management that you want to do. Don't forget to like, comment, and subscribe, and I'll see you in my next one. Bye.